Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we're talking about tobacco control and prevention. With me in studio, I have Dr. Shaliza Gopi. She's a technical officer of tobacco control attached to the Chronic Disease Unit, Ministry of Health. Ms. Dion Brown, Health, Wellness and Environment Management Coordinator attached to the Ministry of Education. And Dr. Walima Bacchus, Respiratory Medicine Specialist attached to the Georgetown Public Hospital Corporation. Welcome, ladies.
Thank you for having us today.
So, as I mentioned before, today we're talking about tobacco control and prevention. Dr. Shaliza, could you provide an overview of the Tobacco Control Act for Guyana and tell us about what it entails?
Sure. So Guyana actually acceded to the WHO Framework Convention for Tobacco Control in 2005, and in 2017 we passed the Tobacco Control Act. So we comply with a few time-bound mandates that I wanted to touch on today. The first one is protection from smoke. So Guyana has actually banned smoking in all indoor spaces. These include educational facilities, schools, retail buildings, and basically any indoor space that is accessible to the public. Additionally, in public transport, it's banned, and in certain outdoor spaces such as parks, playgrounds, and stadiums. So the second mandate has to do with packaging and labeling. So you would notice if you go into a store and you wish to purchase a tobacco product, first of all, you shouldn't see it on any shelves. If you want to purchase it, you have to ask the salesperson to see it. And then when you hold it in your hand, what you would notice, well, you're not supposed to hold it until you purchase it. You would notice that on the packaging itself, you have specific graphic images that tell you about the dangers of tobacco smoking. And we have very specific regulations. So if someone wants to import any tobacco product, they have to seek permission from the Minister of Health, and we have to ensure that they meet all of these regulations. The next mandate states that we have a 100% ban on taps, which means tobacco advertising, promotion, and sponsorship. So that means you're not supposed to promote any tobacco products whatsoever. Okay, so those are a few of the main ones.
You mentioned that smoking is not allowed in public spaces. And I want to ask, what happens if someone is found doing this? What measures are in place?
Excellent question. So if you're found smoking, it's actually an offense that you have committed, and you're liable to a fine of $10,000 for the first offense and $20,000 for the second or any subsequent offense.
Wow. Quite interesting and important fact there.
And just if I may add, so all prohibitions in this section actually apply to the use of electronic delivery systems and any other product that produces an aerosol that could be confused with tobacco smoke or that stimulates smoking.
Okay. What are some of the work that you guys would have done over the past years with regards to tobacco control and prevention?
Okay, so at the Chronic Diseases Unit, we're continuously doing sensitization events. So what we do is we train persons from the public, not only the public, but various stakeholders on the TAPS ban, so the advertising, promotion, and sponsorship, and also smoking policies. And we do this in collaboration with Ms. Dion Brown from the Ministry of Education. Additionally, we have also been receiving training on tobacco cessation. Myself, along with Dr. Bacchus, was privy to this training. And since then, she has started training at Georgetown Public Hospital with her patients.
Okay, wonderful. Whenever you guys do sensitization across areas and so forth, how do people respond?
Okay, so they're actually very surprised at the smoking policies because they say that they see persons smoking all the time, but they never knew that it's in the act. So they're very empowered that we have this act, and now they say that, okay, well, now that I know it's here, I can go out and I can actually tell persons, hey, you need to stop smoking.
Well, then a changed behavior is coming about with the work that you guys are doing. Wonderful. So we're going to go into a short break and be right back with more on tobacco control and prevention. This is Health Matters.
I got second tower.
Yeah.
Like a pack now. But where's all these things for this packet?
Hi, mister. That is the new law. Them cigarette manufacturers
have to put those images on them pack.
Yeah, but with all these scornful thing they got here, boy.
Because they're showcasing the effects of cigarette. And it also says
Smoking is dangerous to your health. Feel like I change my mind.
Let's all work together to prevent cigarette smoking related illnesses. A message from the Ministry of Health with support from PAHO WHO.
For those persons who have just tuned in, today we're talking about tobacco control and prevention. Ms. Dion, I know that you have been doing a lot of work with the Ministry of Health, especially the chronic disease unit with regards to tobacco and control and so forth. Could you tell us of some of the programs, prevention programs that is, with special emphasis on tobacco control and prevention?
Yes, sure. As Dr. Gopi had mentioned before, what we've been doing over the last year, we've been working with providing sensitization to key stakeholders on the Tobacco Control Act. And these stakeholders include members from the Guyana Police Force, the Bureau of Standards, persons within the Ministry of Health, the various health centers. We also have been working at the Ministry of Education under the umbrella of drug prevention education, of which tobacco control happens to be one of those programs that we focus on. Because in our schools as well, we have pockets of cases where students are vaping, students are using tobacco-based products, and so we need to provide ongoing sensitization to the learners under our care as well.
Okay, so whenever you guys go into schools to do sensitization, how is it done? What is the process like, and how do students respond as well as teachers?
So for the sensitization sessions that we have, we provide training to our teachers so that they're fully oriented in some of the common drugs that are used within the schools and that are found in Guyana. Specifically for tobacco, we work with our teachers, we work with our parents, we work with our students. So sometimes you have joint sessions with both the parents and the students. Sometimes we have sessions separate and apart with the teachers only, so that when they get into the classroom, they know how to treat or how to deal with those minors under their care. The responses are overwhelming, I think, from various groups. From the students, we get that they're fascinated that we are aware of some of the products that they're using. It's a mixture for the parents, because the parents sometimes are in denial that their students or their children are actually using these products, and they're at an experimental stage, and so it's a learning and an exploration process for the student. But at the same time, we want to ensure that it's controlled, because it's not for them to make that decision at this age. There are a lot of dangers that they're exposed to, and so the basis of our educational programs is to ensure that the information and awareness is out there about the dangers of tobacco use. And Doctor will share a little more about what's happening at her end from a clinician's perspective. And so for the parents, it's always an eye-opener. For the teachers as well, it's one of those things where you always have to be on the alert when it comes to monitoring your students, and some of the products that the sellers, the manufacturers have with regard to tobacco-based products. They're very unique and they look almost like everyday gadgets, so they have to be aware when they're monitoring the students under their care.
Wonderful. The work that you guys are doing is really commendable, and I'm happy to hear that you guys are involving parents as well as teachers, because we know that when students go to school, most of the time they're with their teachers, and when they're at home, they're with their parents, and it's good for both parents and teachers to be in the know, you know. So very, very good work to all of you. Ms. Dion, again, what are some of the policies that are in existence with regards to tobacco control and so forth?
Well, the first policy or legislation that's in place is the Tobacco Act of 2017 in Guyana, which provides that through the Ministry of Health, you're to have no smoking zones in all government spaces. And so one of those government spaces, as Dr. Gopi had mentioned, is the Ministry of Education, where all of our environs have been declared smoke-free. This has been the process since 2007, and so it's an ongoing effort to ensure that those environs remain smoke free. By that I mean our school facilities and other educational facilities as well. We ensure that in terms of other policy mandates, the Ministry of Education has what is called the Safe Schools protocol. That document dictates there's a zero tolerance policy on drug use within the Ministry of Education, and tobacco will be classified in accordance with same. We also have a protocol that dictates the how to treat with minors who are found in possession of drugs within the Ministry of Education. And so those are some of the things that we have in place to sort of guide our operation at the level of the schools.
I'm actually very happy that you touched on minors, because my next question was going to be how do you guys relate to minors with regards to tobacco control? How is sensitization done among them?
Well, sensitization can take many forms when we're working with our minors. Just recently, we had a very interactive concert with a few students at one secondary school in Guyana, and it can be done in the form of an outreach. It can be done in the form of a fair. It can be done in the form of a classroom intervention through our health and family life education program. So you ensure that at least from the curriculum perspective, we try to integrate these teachings into our health-based curricula so that our students are able to benefit effectively from all angles.
Thank you, Dion. As we work towards the prevention of tobacco use and so forth, one of the most important things that persons need to understand is the effects of tobacco on their overall health. Dr. Backus, could you tell us about that? How does tobacco use affect one's health?
Thank you. Sure. So that as you smoke, the smoke enters through the airways. It goes to the lungs, and then from the lungs, it enters the blood. And from there, it could basically travel to any organ or any part in the body. Tobacco basically has thousands of chemicals within it, 40 of which are known agents to cause cancer. Other agents within there are things like benzene, which you will find in gasoline, for example, ammonia, which you will find in cleaning products, formaldehyde, and so forth, right? There are also dangerous gases that are emitted, like carbon monoxide and nitrogenous gases. When all of these enter the body, there are several changes or several damages they can do. One common changes is to cause abnormal cell growth, which will lead to cancer. So cancer from tobacco use could happen in any part of the body, starting from the mouth to the throat, the larynx, the airways, the lungs, the stomach, the bladder, the kidneys, you name it. Anywhere is possible. Lung cancer is the leading cause of death from cancers. And it is also the number one cause for lung cancer is actually smoking or using of tobacco products, right? Other diseases that could develop would be heart diseases, which is quite common. So it can increase your blood pressure. The carbon monoxide combined with the nicotine could damage the inner lining of your blood vessels. And when that happens, it has all of these fat deposits are going to come and accumulate there, causing plaques, which we know as atherosclerosis. It can also cause the platelets within the blood to become sticky and forms a clot. Both of these conditions could lead to decreased blood flow and decreased oxygen to the organs it supplies. If it's the heart, it could lead to chest pain, it could lead to a heart attack, it could lead to arrhythmia, which is irregular heartbeat. If that clot goes to the brain, it can cause a stroke. If it goes to the lungs, it can cause pulmonary embolism, for example. All right. It can also affect the lungs and the airway. A common disease and the number one cause for airway disease from smoking is something called COPD, chronic obstructive pulmonary disease. So that's an umbrella term for two common conditions, chronic bronchitis and emphysema. What the smoke does is that it damages the airways. It causes swelling, inflammation, and a lot of mucus to be produced. Right? It can also, and that will block the airflow natural for you to breathe in and out. It will also damage the little air sacs, which are called the alveoli. It destroys their elasticity and it damages the walls, which will decrease your oxygen from entering and exiting. Both of these conditions, when combined, can cause the person to have shortness of breath, especially when you're moving around, coughing, the smoker's cough, as we normally would call it, wheezing, chest tightness. And as the disease progresses, they will start to have changes in the lips, discoloration, swelling, and so forth. There are other diseases as well that is caused from smoking, such as kidney diseases, diabetes, and so forth. Pregnant women who are smoking, they could lose their babies, either stillbirth or miscarriages. They can go into premature labor, for example. They can even have a small baby for the age of the pregnancy. If they're breastfeeding, nicotine is transported in breast milk. So babies can have vomiting, diarrhea, they can have restlessness, irritability. Children who are smoking and adolescents, it damages the lungs and it prevents lung growth and development. This would result in them developing COPD at a very young age, like in their 20s or early 30s. If they have asthma and they're smoking, it worsens the asthma and it can even drive the asthma over into COPD category. Smoking actually contributes to millions of deaths worldwide every year, and it is estimated that 1 out of every 4 deaths is actually smoke-related deaths.
Wow. So we see that smoking does not only affect the person who is actually doing it, but also persons around them as well, because you mentioned children as well. Wow. So definitely prevention is necessary.
Yes.
So we're going to go into a break and be right back with more on tobacco control and prevention.
Hello, sir. You can't be smoking with passengers in the car. I got me little child in there. I mean, I can't smoke in your own car.
You know it's against the law for taxi drivers and minibus drivers to smoke, especially when you got a child under 16 in the car.
If you don't like it, go come out my car, man.
Just to let you know, the law states that even if you're in a car alone, you can't smoke because the fumes can get into the fabric and affect your passengers.
Let's all work together to prevent cigarette smoking related illnesses.
Thank you for staying tuned. On May 31st, we will be observing World No Tobacco Day. Could you tell us what this day entails and what is the aim of this day, Dr. Gopi?
Okay, so this day is basically celebrated among the entire world, and Guyana, of course, will be joining in the celebration. And this is to promote, encourage persons not to smoke. We want to give, this year we're giving persons one more reason to quit by telling persons, smoking is harmful to the environment, especially with the disposal of cigarette butts. So this year, we will be collaborating with our friends at the Ministry of Education to host a sensitization event. We will be out on the Main Street Avenue on Tuesday, the 31st of May from 10 a.m. And we're inviting everyone to come and join us, come learn about the dangers of tobacco smoking, come learn about this Tobacco Control Act.
Okay, for persons who are in the region, how can they benefit from these activities as well?
Right, so it's not only in Region 4, Region 3 will also be doing sensitization. They will be having booths at Charity, Anna Regina, Suddy, and Supanam, so you can go out there and join them. In Region 7, they will be having health talks to the patients at various hospitals and the facilities. In Region 8, they are planning a march at the Pacaraima Mountain area. And in Region 6, they will be having symposiums in New Amsterdam, Rose Hall, and Curvaton.
Thank you so much, Dr. Gopi. We're definitely looking forward to those. Before we wrap up today, Ms. Dion and Dr. Bacchus, could you do you have any word of advice for our listening and viewing audience?
I would like to address the parents directly. We've seen an upsurge in students who have admitted to vaping and so on. You have to be vigilant with your children. Have a conversation with them to find out, who they're hanging around,
Yes.
what they're using, what they're getting into, and so on. And have frank, open conversations with your children about the dangers of tobacco smoke and its use as well.
To add to what Miss Yan has said, I just want everybody to know that even if you're not smoking and somebody is smoking around you, second and third hand smoke, you're still at risk for all the disease that I would have explained already. So my best advice is, if you're not smoking, do not think or even consider smoking. And if you are smoking, there are help out there. Seek the help so that you can quit smoking.
Wonderful. Thank you once again for joining me on this program today. It has been quite informative, and I do encourage you to continue the good work that you guys have been doing in your various departments and across the regions of Guyana.
Thank you so much.
Alicia.
Thank you.
This has brought us to the end of Health Matters for today. I'm Alicia Martin saying goodbye.